Hello everyone, this is a preview in pediatric rheumatology.
A 4-year-old girl has joint swelling for 8 weeks. Her symptoms are worse in the morning. She has swollen knees and fingers. Sometimes she limps and has difficulty walking. She doesn't have any fever, no skin rash, no vomiting, no blurring of vision. On physical examination, her right knee is swollen and tender with limited range of motion. CBC, CRP, ESR, ANA, rheumatoid factor urinalysis, C3 and C4 are all within normal ranges. What is the most likely diagnosis? Reactive arthritis, septic arthritis, juvenile idiopathic arthritis, psoriatic arthritis, systemic lupus erythematosus. The correct answer is juvenile idiopathic arthritis. The most important diagnostic point, unexplained joint swelling and pain longer than 6 weeks, is a diagnosis of exclusion, even with all labs are normal. This is a classic case of juvenile idiopathic arthritis.
Juvenile idiopathic arthritis. Previous name is juvenile rheumatoid arthritis. Idiopathic because we don't know the exact cause. It is defined as arthritis of one or more joints occurring at least 6 weeks. Chronicity is the key for the diagnosis. There is no certain lab to confirm the diagnosis of juvenile idiopathic arthritis. It is a diagnosis of exclusion. Again, very important to know that juvenile idiopathic arthritis, the diagnosis is made by chronicity, at least 6 weeks in a child less than 16 years of age. Painful joint, inflammation of joint. The most important sign is limited range of motion, chronicity at least 6 weeks. Again, there is no single lab to prove or confirm the diagnosis. It is a diagnosis of exclusion plus chronicity. Detailed history and physical examination will help you to narrow your differential and to be able to order the appropriate lab to rule out other diseases. I will give you a few examples here, like reactive diseases, for example post-streptococcal infection, rheumatic fever. Other inflammatory conditions like inflammatory bowel diseases can be associated with arthritis, sarcoidosis. Infection like septic joint, osteomyelitis, post-infectious toxic synovitis, very common. Systemic diseases like lupus, Henoch-Schönlein purpura, malignancy like leukemia, osteosarcoma, Ewing sarcoma, and trauma. Classification of juvenile idiopathic arthritis. Oligoarticular means 4 or less joints. Polyarticular means 5 or more joints. Systemic onset juvenile idiopathic arthritis means high fever, high spiking fever persistent for at least 2 weeks, plus arthritis. This will make the diagnosis of systemic GIA is very likely. If oligoarticular or polyarticular associated with positive ANA, this will increase the risk of iritis, uveitis, or iridocyclitis. So these patients, they need a close follow-up with ophthalmologist and slit lamp examination. Very common that juvenile idiopathic arthritis, they have negative RF. So RF is not helpful in the diagnosis of GIA. So if it's positive, this just will give you a hint that this patient is likely to continue to have or there is a risk for this patient to continue to have rheumatoid arthritis during adulthood. This is a classic presentation of juvenile idiopathic arthritis. The joint is painful, tender, warm, swollen. The pain worse in the morning, can be associated with limp. The symptom has to be persistent for 6 weeks, and you have to rule out all possible causes of arthritis before you make the diagnosis of juvenile idiopathic arthritis. Systemic GIA is arthritis associated with fatigue, anemia, fever. The fever usually greater than 39 Celsius. The fever comes once or twice a day, associated with a salmon-colored macular rash, usually non-pruritic, so the rash comes and goes with the fever. Hepatosplenomegaly, lymphadenopathy, pulmonary like interstitial fibrosis, pericarditis, leukocytosis, thrombocytosis, elevated ESR and CRP, and serum ferritin. ANA is usually negative.
A 10-year-old girl has been complaining of muscle weakness, pain in both arms and legs, and fatigue for the last 2 months. She has on and off fevers, unexplained. She has difficulty walking. She has also a skin rash on her eyes and her hands. She was treated for possible eczema with topical steroids, but the skin rash is not going away. Physical examination, she has rash which is red, scaly bumps overlying the knuckles of her fingers, as well as reddish purple rash around the eyelids. What laboratory of choice will confirm the diagnosis? creatine kinase, ANA, C3 and C4, CBC, or anti-double-strand DNA. This is a classic case of juvenile dermatomyositis, and creatine kinase is the correct answer to confirm the diagnosis will be significantly elevated. She has muscle weakness, and she has the classic Guttron papules in her knuckles and also the heliotrope rash around her eyes.
Juvenile dermatomyositis, from the name, is inflammation of the skin and muscle. The presentation or the classic presentation, muscle pain and weakness. Skin rash, which is exacerbated in sun exposure or photosensitivity. Guttron papules, which is elevated shiny violaceous papules over the bony prominence, for example knuckles. Heliotrope rash is purple or dusky rash around the eyes or in the periorbital area. Calcinosis cutis, which is firm nodules, white or flesh colored over the bony prominence. Diagnosis is made by detection of elevated creatine kinase level. Treatment is prednisone, sun avoidance, and hydroxychloroquine for rash. This is a very interesting disease. The name itself explains the disease: periodic fever, aphthous stomatitis, pharyngitis, and cervical adenitis, PFAPA. It's a benign syndrome, the most common age of presentation between 6 months and 7 years. The main is 3 years. The periodic fever usually lasts from 5 to 7 days. Periodicity is usually less than 4 weeks. Usually there is no signs of infection, so if you do throat culture, usually negative. Children in a good health between episodes. Fever cycles usually stops by teenage years. It's a clinical diagnosis. There is no specific test to confirm the diagnosis of this illness, so it's a clinical diagnosis. Treatment is non-steroidal anti-inflammatory drugs. Actually, a single dose of steroid like prednisolone or prednisone can dramatically shorten the illness and even end the episode. Tonsillectomy if the patient requiring multiple doses of steroids per month.
Another cause of periodic fever, cryptopyrene-associated periodic syndromes, or well known as CAPS. We have 3 different types of CAPS: familial cold autoinflammatory syndrome, Muckle-Wells syndrome, neonatal onset multi-system autoinflammatory syndrome.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the Last Minute Review series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams!